We can fly today. Okay, I will call this meeting to order. We'll have roll call beginning with the sheriff.
Sheriff Tom Johnson III.
Danny Lambert for David Hooten.
Rick Warren, court clerk.
Joe Blau for Kerry Bloomer.
Brian Munn.
Butch Freeman, county treasurer.
Larry Stein, county assessor. I'm not even sure I got an inning.
You didn't even get an inning in, did you?
Third.
Commissioner Bloomert has joined us, and the meeting was properly posted on June 14th. We'll now have the Pledge of Allegiance led by the assessor.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Larry. Is there a motion to approve the minutes of May 19th and June 9th?
Motion to approve.
Second.
All in favor, say aye.
Aye.
Any individual consideration on the consent docket? If not, is there a motion?
Yep, Mr. Chairman, I would move that the consent agenda be approved, items 3 through 33. It's, I believe our agenda recommends 29, but I think there are 3 more that are misnumbered, but still. So I would move that consent be approved, items 3 through 33.
Second.
Okay, is there any other discussion? All in favor, say aye.
Hold on,
Aye.
I want to clarify.
Aye.
On my screen, it just shows it goes to number 31, and then there's not a number 32 and a number 33.
If you'll, on your agenda, it goes 29, 30, 33, 32, 31.
Oh, okay.
What's it happen on the electric?
You know, I hate to have to be explaining things to commissioners.
I see it now.
So,
I see.
Okay.
so are we going to have a motion to renumber 32 and 31 after 33 to approve them as number 34 and 35?
No,
What would you like your motion to be?
the motion is to approve items 1 through 33. I'm sorry, 3 through 33.
3 through 33.
Okay, I get you. All in favor, say aye.
Aye.
All right.
Now, but renumbering the number, misnumbered 32 and 31 to 34 and 35?
No, good God, no.
They're
Clerical
just
errors.
out
I
of
think they're
order.
correct
Okay.
now.
There's no duplicate numbers.
Yeah.
Okay. All right, Danny.
All right, good morning. Yep, that one. Thank you. All right, I'll just hit a couple slides here. Our numbers as the end of May.
Which slide?
The first slide.
Okay.
Listing all the general fund budgets. I've highlighted the amount in reserve. 2.4 million, this is the amount that we will carry forward into next year. We had budgeted a carryover 2.6 million, so a little less than 200,000 what we had budgeted back in April, May. So still in pretty good shape there. A couple slides over is comparing general fund to last year, the revenue and expenditures. To date, we collected 5.6 million more in revenue, and we had budgeted 5.4 million, so right on track with where we should be through May. And then expenditures, about 1.2 million more than a year ago. So everything's in line there. And then the last slide, employee benefits. Just taking all the numbers through May, projecting out the last month, we anticipate we'll end the year with 1.6 million to carry over into next year, which is fantastic. Some of the reasons we were able to carry over so much is obviously we put 2.6 million in CARES funds into this fund during the fiscal year. We've had prescription rebates, a little over 3 million that were deposited in this fund, and some stop loss reimbursements of $1 million. Also, just to note that I think there's an item on next week's BOCC to move a little more than $1 million from ARPA funds to cover some medical claims that will go into this fund as well. So it's looking like we'll start the year next year in real good shape in employee benefits fund. That's all I have. Thank you.
Is there any questions? If not, is there a motion to receive his report?
So moved.
All in favor, say aye.
Aye.
Mr. Wilkerson.
Good morning. Just
Morning,
touch
John.
on this briefly. Danny touched on this. About to end the year. We have one more check register next week. The good thing is, Danny touched on, we're getting $1 million back from ARPA funds for COVID. We've actually, our employees, their dependents, retirees, had $3.6 million in COVID claims through the end of this May. So we still have another month really to calculate. But overall, considering the year we've actually had tons of big claimants this year. So we're going to end the year well. And look forward to next year. But if there's any questions, I'm happy to answer them.
If not, is there a motion to receive his report?
Motion.
Second.
All in favor, say aye.
Aye.
Thank you.
Mr. Compton.
Good morning. There are no changes to the watch list this month. I will just note that there's just a little bit over $2.4 million in the reserve account as of now. Unless something comes up, that will be the money that's rolled over into next year's budget.
If there's no questions, is there a motion to receive his report?
So moved.
Second.
All in favor, say aye.
Aye.
37 is Ms. Kent. Is she present? This was an item to discuss whether or not we would continue to do administrative leave up to 80 hours, I believe, is what we have done in the past for those who suffered from COVID. Joe?
This morning to us, she is home taking care of a loved one who's seriously ill. So she didn't say anything other than that. So that's
Okay.
why she's not present. This morning.
I know from her discussions with me, she was looking for directive again from the budget board. We haven't really addressed this for the recent year, and different departments have been handling it differently. Does the board have any pleasure, preference that they wish to discuss on this item?
I sent a member of my staff around to check how the others were handling it so we could be consistent. And the way I found it is that we're still taking care of the employee. Now, if it's family or something other than that, then we don't do it. But we're still giving the 80 hours if the employee is sick with the COVID. It's 40? Okay.
Is that, and just to clarify, that's 40 hours in addition to any sick leave they may have banked? 40 hours of administrative leave
Rick, come up to the mic.
for COVID-19. Okay.
Rick's the one that I had to look into it.
I'm not 100% that sure that's completely consistent, because I think some
Right.
departments are doing 80.
Okay,
That's what I thought.
I went to payroll, so what are you getting?
There may have not been a need for very many cases
I
in
know
that
it's-
respect.
It's
but
listed as administrative leave, COVID, and up to how many hours?
The extension by the,
and up to the microphone, please. To the microphone.
I'm so sorry. The extension, I believe that Mr. Biden, President Biden put into effect was for an additional 80 hours. Now, I will
That's what I thought.
confirm that.
okay.
But it was to permit the leave, and then it was volunteering that the employer cover the cost of it as opposed to having them use their own leaves. And the last resolution that payroll knew about, in order to code it properly, was that we agreed to follow the same precedents that we had. And that's the purpose of this, is to be consistent and to either extend that or to change it in some way so that we know how to properly instruct employees.
So it's really kind of a matter of policy, whatever this board chooses, at least up to the 80, I guess. So
And the recommendation is 40?
80.
80. Okay, so we are recommending the full 80.
well,
If
it's up
needed.
to you to recommend.
It's what?
It's up to you to recommend. What do you recommend?
I'm not recommending anything.
Well, it's for us to recommend, I'm saying. So if everybody feels like employees can handle that with their sick leave, then you can leave it alone. Or if we want to give payroll some clearance, then we got to come up with a policy for them here.
Is the recommended time away from, recommended time from the CDC in quarantine now, isn't it down to 5 days once you've been
It
diagnosed?
hasn't been consistent with the doctors in my employees' cases.
Okay.
So I'm finding it hard to deal with myself in
Okay.
terms of.
So maybe we should keep 80 hours.
That I don't know how to present that to you exactly, ma'am. I know what the last information was about how much time, and that we had a extension by the federal mandate, but it was not to cover it instead of their own leave. The original one in place said that employers would offer the leave and pay for the leave.
Up to 80 hours. So like some of my employees that's
Yes.
currently, they may be off 3 days, they may be off 5 days. Once they get the test that says they're clear to come back to work, we require a test that says that you no longer have it, you're no longer infectious, and then you come back to work. And it's different for each person, so.
Indeed it is, sir, and that is the question that we get, again, in my office about how should this be coded, where does it fall and where doesn't it fall? So we're just looking for clarification and extension of what's already been practiced.
And if they have 80 hours and they use, say, 26 hours, 35 hours, 40 hours, and then catch it a second time, they would still have 40 hours left to them because they're not just catching it once in some cases.
I have not heard of any abuse of this system at all.
None whatsoever.
No, sir, on payroll and timesheets,
Okay.
we've not seen any abuse.
All right, so we are looking then to extend this or to keep the 80 hours. Is that what we're being asked to do?
I think so.
Yes,
All right, I'll make that motion.
and I'll second it.
Okay, so in your motion, it requires, so that HR has clarity, a doctor's note.
Is that what we've been doing?
Yeah, they have
negative test.
to have a test, first of all, then find out if they have COVID, whether that's a home test or a doctor's test. But then once they have the COVID, then they have to go back to the doctor when they're feeling better and get a test to prove they don't have it.
That's
On
good.
any illness, though, when you're off several days, you need a doctor's to come back to work. So it's consistent with what we
That's
do.
in my motion.
And then is it also in your motion, this is for employees only, not for their loved ones?
Yeah, if the child's sick and you stay home to take care
I
of
see-
your child,
Yes, I see what you're saying. Yes,
we're not applying it to that.
right.
You still use
Exactly.
sick leave for that.
You use your
Right.
sick leave or your annual, whatever you use.
That definitely is in my motion.
I thought I heard that.
Okay. Is the clerk clear on Butch's motion? All
Is
right.
Butch clear on Butch's motion?
Yeah, no.
May I point out one more thing?
Yes.
This isn't in the handbook. This was never extended for COVID or pandemic in the handbook. So this is strictly the resolution that was passed by the board in December of 20, or maybe it was January of 20. Forgive me for not knowing my dates exactly. But the last time that this was addressed, to my knowledge, has not been updated or advanced in any way. And the point of this request is consistency across all departments, because we continue to get in our department questions about how to code and how to track this.
Right.
And so that's the reason I'm at the podium for you, okay, is not to ask you to do something a certain way. It's just so that we're consistent and that we know how to answer these questions. I just wanted to put that out there. Thank you.
All right. Do you feel like we've addressed everything that your coding would need? Is there anything else left? Because
Yes, I believe that would. We will take care of determining exactly how to track that properly, since we're putting a time and a number of hours on it, and we'll help track that and then pass that off to the individual departments.
And does this need to be retroactive to any particular time to have not left any people out?
Again, I don't know how to answer that exactly. I can go back and see if anybody was docked for pay, because that would be the only.
I would think it needs to be retroactive so that we stay keep using the word consistent, so we stay
Yes.
consistent and treat all employees exactly the same.
Thank you, sir.
Larry, do you have a question?
I'm just wondering if any of the folks that are doing where the rubber meets the road, like Marcy, if she needs to address those issues about the retroactivity?
I believe from the previous years to this
Marcia,
year,
you've changed so much.
yeah, thanks, sir.
Haircut.
If we went with calendar year, I think that would cover this for this calendar year.
Yeah, I wouldn't go any further than calendar year.
Well,
That
I
makes
think
sense.
previous calendar years was covered by previous action this
Right.
board has taken.
Mr. Morrison?
I think what we're looking for is maybe clarification of an effective date, because we've obviously had employees that have been sick prior to today and moving forward. So
Did you agree with Mr. Taylor that January 1 of this year is sufficient?
I think we would be fine with that. That's what we're looking for, a clarification of a starting point, because we've already had some that have used 40 hours, or perhaps maybe they've used more than that, because that'll be a clarification that we need to tell our employees as of a specific point in time. This is what you've been allotted, and this is what you've used. This is what you still have left in the bank.
Okay.
That's part of his motion, I think.
Part of the motion
Part
is
of
the
the
first of
motion.
the year, starting
I know I heard
July.
that.
Starting
Are we saying
January 1.
Are we saying January 1st of 2022 to December 31st of 2022?
Yes, that's what I'm saying.
Okay.
All right, Karen?
Could I maybe read what I'm coming up with as
Yes.
the motion, just to make sure I get it in
Yes.
the, okay. I've got to allow employees not to exceed 80 hours administrative leave for COVID illness, to return to work with a doctor's note for, of a negative test, to be effective January 1st, 2022. January 1st.
Do we have to have it be a doctor's or a home test
Doctor's note and or a
eligible?
negative test.
Because you could just go get a test from somewhere without having to see a doctor, right? The negative test.
So,
yeah.
just negative test.
Right.
Return to work with a negative test.
Yes.
With proof of a negative test.
With a negative test.
Yeah.
I just want to make sure I've got it right.
Thank you.
Yeah,
Okay,
that's
thank you.
exactly what I said.
Effective dates first of this year till the 31st of December.
I think she had, yeah, I think so.
And that is just for the employee.
I was just questioning, do we need a positive test proving that they have COVID?
Yes.
Yes.
December 31st is the end of this resolution, going back to January 1st, and that it's for employees only.
Through December 31st. All right, thank you.
I don't see Mr. Barnes here. Maybe Cody or Joe can answer this. Do we keep COVID tests on hand for employees to have one?
I think the clerk's office has some, right? Danny?
Okay.
He doesn't, but I know.
Okay. Okay.
All right, we got all that down?
Good motion, Butch.
Yeah.
Second?
Okay, all in favor, say aye.
Aye.
I will never again make a motion.
Promise?
Okay, Larry?
Never say never.
Hey, Mr. Chairman, and after you said that, I would move that we take items 38 through 44 in total. They all they're all on the same issue, and that is just the late transfer of funds, as we always do this time of year, just to make through the next two. And so they're all exactly the same. So I'd move that we approve items 38 through 44.
Just before we entertain your motion, we'll have the record reflect that Chief Deputy Miles Davidson is now in the chair.
Sounds like seed corn.
All right, now as we've heard his motion, is there a second?
Second.
All in favor, say aye.
Aye.
Mr. Whipperson.
Number
May
of
not reflect
Sure.
District 3's vote on that vote? There were only 7 votes? Yes, sir. Okay, thank you.
On 45, this is just a standard renewal with Delta Dental. There are no changes.
Is that true of all the remainder ones too?
No, sir.
Okay.
So I'll work
Is
with
there a motion on 45?
Motion to approve.
Second.
All in favor, say aye.
Aye.
Item 46 is for our regular health plan network, where employees pay part of the cost, we pay part of the cost. With Healthcare Highways, there's no changes to that one.
Move approval.
Second.
All in favor, say aye.
Aye.
Now, on 47, this is with AIM clinics. They're our primary care clinics. One of our options are 100% options for employees. They're going to be doing outreach to employees and doing some free health clinics, et cetera, but that's really, there's no changes to that agreement.
Move approval.
Second.
All in favor, say aye.
Aye.
On 48, this is Lucid Lane, if you remember that. They do pain control, counseling, other things. There's a big change to this in regards to extra services for our members. They're going to introduce transitional pain control on major surgeries, which is very important. And those are those really big spinal surgeries, the big surgeries that require a lot of rehab and pain control. But they're going to work with the surgery center and our other partners to get those people involved with some transitional pain control. And what that means is hopefully less ER visits, less inpatient admissions, but it's just an additional service that's really going to help our members.
Increase in cost?
It's the same cost as our other services. So if members agree to enter this transitional pain care, it's a $500 flat fee. Well worth it.
That the employer pays or that the employee?
That we would pay.
Okay.
So is that an increase from previously?
It's an additional service that was added. So it wasn't in their agreement previously, that transitional pain control. So if a member was going through a real difficult, complicated surgery, they wouldn't have that service available to them before.
Do we have any fiscal impact or anything, ideas about how much that costs?
It shouldn't be
Additional
much.
costs?
No.
Move approval.
Second.
All in favor, say aye.
Aye.
And then number 49 is our other brain care provider, Revis. They're going to be doing some additional employee outreach to departments just to remind them of their services, but there's really no changes to that agreement.
Move approval.
Second.
All in favor, say aye.
Aye.
And number 50 is for our Vision Service Plan, VSP. No changes to that agreement.
Move approval.
Second.
Number 51 is our retiree.
we didn't vote.
Sorry,
All in favor, say aye.
Aye.
Now,
apologize. Number 51, this is our retiree Medicare supplement policy. Works very well for our retirees. The good news is no cost increase for this.
Move approval.
Second.
all in favor, say aye.
Aye.
And then number 52, Health Smart. They're our third-party administrator for our health plan. A minimal increase of 25 cents per employee per month, which equals about $3,000 a year. And our fees are about half of what the market is on these fees, so we're in really good shape.
Move approval.
Second.
All in favor, say aye.
Aye.
Thank you.
Number 52, John Wilkerson.
That was
was
52.
52.
Yeah,
Gotta come
they're
out.
just behind one there. All right, any citizens to speak to the budget board? Board comment, Sheriff?
No comment.
Danny?
No, thank you.
No comment.
Ms. Bloomer?
I'm trying to find, Brian Jasper is my superintendent for District 1, and he just celebrated, Cody, 23 years at the county. Where's Joe? He's worked here since 1999. He just hit an anniversary, so I wanted to publicly, I think that's 23 years. Yeah.
Else?
I apologize for being late. Sorry about that, gentlemen and ladies.
Butch?
I do have one quick item. Attended yesterday the monthly meeting as set up by the Oklahoma City Chamber, and where they have excellent subjects and excellent panelists. And yesterday they had an excellent panel. We had our own Sheriff Tommy Johnson, our own Commissioner Kerry Bloomert, along with Jim Couch, and the entire the subject was the upcoming jail vote. And so, as you can imagine, it received a lot of interesting questions, a lot of very interesting dialogue. All of our folks, all three of our folks did just an incredible job. They really did. I even was proud to say that they were from county government.
Larry?
I attended that luncheon also, and Butch this time took the elevator rather than climbing up the outside.
Yeah.
Okay, any new business? Is there
You're
a
a dead
motion
man.
to adjourn?
So moved.
All in favor, say aye.
Aye. And our sheriff is the most